Endometriosis is a very distressing disease. The triad of endometriosis is dysmenorrhea, that means pain during periods, pain while having sex, and infertility. I think these three are the most distressing symptoms of endometriosis. But one thing about endometriosis is if it's caught early and treated well and the patient becomes pregnant, the disease really disappears. So it's very important that you approach your doctor and get treated for endometriosis. The diagnosis of endometriosis is made by a laparoscopy. A sonography may probably help, sonography or an ultrasound may probably help us in diagnosing chocolate cyst, that is endometriosis of the ovary, or adenomyosis, which is endometriosis of the uterus. But if there is peritoneal endometriosis, we need a laparoscopy for diagnosis. And the treatment is, the first line of treatment or the golden standard of treatment in an infertile couple is a hysterolaparoscopy. So with laparoscope, we put in a telescope into the abdominal cavity through a small incision on the navel, and then whatever endometrial deposits are seen in the abdominal cavity are burnt. This definitely prevents the disease from progressing. If there is a chocolate cyst, this is removed and treated. And immediately, if endometriosis can be graded depending on the laparoscopy findings into mild, moderate and severe. Usually the mild endometriosis can be treated with IUI or even planned intercourse. The moderate to severe endometriosis, depending on the tubal status, if the fallopian tubes are patent and a good semen count, we can do an IUI 1 or 2 cycles. But if she doesn't conceive with an IUI, we must shift to IVF. Ideally, for severe endometriosis, IVF-ICSI will definitely achieve pregnancy faster and with a better pregnancy rate in these patients of recurrent endometriosis. So if you have endometriosis, approach the doctor fast. Surgery is the golden standard, but do not hesitate from switching over to IVF or ICSI to achieve a pregnancy, because sometimes we have to land up using egg donation for these patients if the ovarian reserve is totally damaged.